Hi, I'm Dr. John Hatch here at Brain Rehab Clinic. I'm excited to show you what to expect when you first come and the purpose of all the tests and what you're going to experience with therapies, with treatments, and then follow-up visits and how important it is for us to see what your brain is actually doing. So right now I'm going to take you through each test and show you not only its importance, but how I interpret it and how that is important into your issue that you might be dealing with. Let's go. This is the vestibular technology system, also known as the CAPS unit. We use this to determine your balance system and how your body is fighting against gravity. We use it on a stable surface as well as on an unstable surface, as well as with eyes open and eyes closed. By determining how stable you are in certain positions, whether you're swaying too far forward or you're swaying too far back, or you tend to fall to the left side or to the right side. That gives us input and information on how we can program your system or activate your exercises specifically to your brain. And why do we need this information? Because gravity is the only constant in life, and how your brain adapts to it is crucially important. Even while you sleep, you are still using your system on what position makes you the most balanced. So we can determine a lot by this simple diagnostic tool, and then we can use the same diagnostic tool to show whether we're making a difference or not on our therapies as well as your system. This is the VNG Room. In here we use an eye goggle headset that has 2 sets of cameras on it that will have videos of your eyes as you are watching a screen to follow a target. Sometimes it will make you feel like you're on a little roller coaster, walking down a grocery store, moving around in a car, and all these moving parts gives you this information so I can see how you handle your environment that you're walking through. Why is this important? Because your brain wants to control everything that happens, and your eyes are the only sensory organ that activate every part of the brain. So whether in the dark your alignment is off, which is usually caused from traumatic brain injury, or that might be from some developmental disorder or anything that could happen, infections, any cause, we can see what the eyes and the brain is doing and then apply therapies and do, again, post checks to see, are we making a difference or are we not? And it's all based on the therapies and the treatments we give you that are specific to your findings. We're now in the NSI Room. This is a diagnostic tool that we use that can differentiate your visual awareness, your timing with audio, or just spatial awareness. And we use this diagnostic tool to give us a great baseline of where you might be in your executive brain function. So we use this NSI system in order to determine, do we have a visual imbalance? Do we have a timing issue? Which will then work with our frontal lobe and our temporal lobe and the different areas of your brain. It is also then used with different substrates within the diagnostic test as therapies that then we can re-post check to see if we get a better outcome in your brain. One of our last piece of diagnostic equipment that we use here at the clinic is called CogniView. This is actually an FDA-approved baseline for cognitive impairment. It's a new addition to our clinic. This brought us huge information on a big question that I had with a lot of patients. There's a lot of people that come in and I ask, how's your memory? How's your short-term memory? How's your visual memory versus your language and arts and arithmetic type of memory? And they're really not sure. This differential diagnosis allows me to assess the difference along with some of the other tests in the clinic with the NSI. We can differentiate word memorization or verbal memory and which side do we need to work on more. So we come in, it has baselines of what cognitive it is, what a mild impairment is, and what a severe impairment is. So we like this at the beginning of our care to know where you're at, and then to see the changes we make and what we can get your brain to, whether that be in the elderly, whether that be in the young, or whether that be post-head trauma. This has 100 different diagnostic tests. It never runs the same test, so you can't adapt to it. You can't get better at it unless your brain is improving. Now that we're done with all the diagnostics that we use here at the clinic currently, we are now moving on to therapies and the treatments that are performed here in the clinic, different from the exercises that you're going to do at home. This NSI unit that we just used as a diagnostic tool also has multiple sub-levels and multiple different ways of using it as therapy. When we find a specific area of your brain that's not working, we know there's certain ways to activate that area through different neurostimulations. And one of that might be something such as this, that you are searching for letters or numbers or words that's activating one visual field of your brain, and this therapy could be something very specific to your needs. And again, there's a host of other therapies on this that each person might be doing something completely different even within a day's office visit. One of the pieces of equipment we use as therapy here at the clinic is called a Gyrostep. Some of you have heard of it, some of you have seen it. It's the only one here currently in the state of Utah, and the Gyrostep serves a simple purpose. This is a machine that can pitch that anterior canals within your inner ear called the vestibular system. When there's been head trauma, when there's been developmental delays, OCD, anxiety, coordination, balance, learning, planning, behavioral imbalances, there are common vestibular cerebellum imbalances. Sometimes for people with vertigo or dizziness, they'll get off on balance with one specific side. Well, you don't just treat the weak side, but you can't just drive it in any and all directions. It's a very specific tool we use to activate a very specific area of the brain. And understanding how this works is very crucial to rehabbing your brain. A lot of times people will think this is like a giant roller coaster and we're having fun. But in the truth of it, it's a specific therapy to activate a very specific canal that can't be done without taking out the other variables. That's why it's not something that can just be replicated by a front flip or a back flip. We want to be specific to a canal and activate that, which also reflexively inhibits an area that might be overactive. It's amazing. This is the RPSS unit, also known as the Repetitive Peripheral Sensory Stimulator. So with this RPSS unit, our biggest thing that we are doing is activating the specific sensory nerves feedback loop to the brain, into the brainstem, through the cerebellum, and up into the parietal lobe. And this is hugely advantageous in traumatic brain injuries, in developmental imbalances, anxieties, OCDs, the things that people are dealing with that have a weakened pons system. So when you come to this station or this portion in your treatment, in your therapy, the physician assistant will take an RPSS unit, and it's a little electrical stimulation, and we use it on different portions of the cranial nerves, on the gut to activate the vagal nerve, whether we use it on the peripheral system to activate a system that might have neuropathies or imbalances. And our biggest focus on this is using it to stabilize and calm down an hyperactive brain. So here right now we're at the laser station. And why is the laser so important? I get so many questions about, hey, is this light therapy working? Is this therapy working? I've connected with a company called Shed Light, one of my absolute favorite companies of all the laser and infrared therapy out there. There is so much information on what is called photobiomodulation. There's been so many research articles out there, even ones just recently published about how it improves natural gut bacteria. And that's crucial to someone who's had chronic digestive issues. So this has been something that has not only helped from a gut standpoint, it also has helped improve brain function. And what we're trying to do, in simple terms, increases energy and blood flow with light therapy to the areas of brain that we're trying to connect. We've also seen faster and better results by being more specific on therapy with conjunction of light and laser therapy to make it even work at a higher level. So a lot of the places we target with our light will be specific to areas of the brain, cerebellum, brain stem, and even throughout certain target points that people have had injuries to throughout the body. But we like to focus more on the brain than anywhere else. So now that you've done all your diagnostics, you come in here, and this is where we get to put your whole story together on what is going on with your brain and what we're missing, or what your system is missing to perform the ultimate function of your life. So we come in here, we go through each diagnostic test with you, we create a plan. As you can see behind me, this is a specific plan for a specific patient. And the beauty of it is no two people are the same. So what you will do in here with the therapies and the other things we have for you might be different than the family member, than a friend, than a loved one. And you have specific at-home exercises that will improve your brain function. Now that you have your plan, people always ask, well, how long is this going to take? Or how long is this going to last? And what we've studied in neurology and brain rehab has been it takes somewhere between 3 and 4 months to create neuroplasticity. That's the base to showing that the brain is changing. Sometimes people make changes really quick, sometimes they make them far. So in our first intense week, we want to see these changes so that we know as we're doing the at-home brain exercises, we're on the right track to improve you or your child's brain at the highest level. And that's why it's heavy in the beginning, and then follow-ups are based on the need, and the best part of it is we can always check and recheck and make sure we're making a difference. And as you continually do your exercises and continually improve your brain, you'll get the outcome you desire. Thanks for joining me on a tour of our clinic here at Brain Rehab. We look forward to seeing you, and I look forward to hearing your story and see how I can help you. Have a great day.